Right, hi all. Today I'm discussing this with a patient of mine. Both her and her husband are sitting in the room, and they've been referred to me with a diagnosis of polycystic ovaries, and I need to now get into the depths of this all for them and give them a good understanding of what the problem is. They've come to me because they are struggling to have a baby. Now, when the doctor scanned the patient, we had a lot of little egg sacs in the periphery around the outer aspect of the ovary and a very thick internal aspect. Now, this thick internal aspect is where the excessive male hormones come from in patients that suffer from the condition. So there is first a classic ultrasound picture which this patient has. I have sent her for hormones to look at her male hormone levels, and interestingly, her own testosterone level is elevated, and she does have oily skin and she does have acne, and this is really causing a lot of distress for her. The other thing is she hardly ever has a period, which for us in our terminology would indicate to me that she is not ovulating on a regular basis. So this patient has three issues. Number one, she's got the ultrasound picture. Number two, we've done blood tests on her to confirm her hyperandrogenism, in other words, her abnormal high male hormone levels. I have also looked at her, and her upper lip has a lot of black hair which you can actually shave, and she has black hair under her chin, and this is very disturbing for her, especially where she has to lie every night with a mirror and a torch and pluck all the hairs out. So at the end of the day, having come to me now for pregnancy, we have to make sure that her husband's got sperm, that her womb is normal, and yes, here we have ovaries that need to be kick-started to then get the ovary to grow an egg, and provided the male, and in this case the male, has very good sperm, we will then get the couple to have intercourse at the right time, and the ability to get them pregnant under these circumstances is exceptionally good. The next issue for us in this patient is the fact, how are we going to treat the oily skin and etc. And often we have to treat it symptomatically because there's no magic drugs for it. If we weren't trying to get the patient pregnant, we can put her on anti-androgens, which will reduce this for her. But when we're trying to get her pregnant, we have to induce ovulation. Now, had this patient come to me at a stage where she didn't want to conceive, what we would do is control her hair growth with medication. So there's anti-androgen drugs we give them. We put them on the pill because they don't want to fall pregnant. The pill will give them regular cycles. Certain pills also help the oily skin and the acne. And at the end of the day, that's it. If you have polycystic ovaries and you want to fall pregnant, go to a fertility specialist, number one. Number two, never, ever, ever let a gynecologist do laparoscopic ovarian drilling on your polycystic ovaries. You will go from hero to zero with your eggs. And I cannot stress it enough. Never, ever allow a gynecologist to laparoscopically burn your ovaries. Run far away from that doctor. And the final thing is, if you're not wanting to fall pregnant, we will put you on the pill. There are special anti-androgen pills. We have got other water tablets which are also anti-androgens, so we can manage your oily skin, your hair growth, and your regular cycles with medication.